สวัสดีค่ะ and good afternoon. Welcome to the English language summary of the daily press briefing live from the Center for COVID-19 Situation Administration, or the CCSA. For today's briefing, Thursday, the 13th of May, 2021, let me start off with the general situation and the number of cases. Today we have an unusually high number of confirmed cases at 4,887 cases. You see on the screen on the slide right now, yes. And I'll get into more details a little bit later about this particularly high number today. So that leaves us with a total number of confirmed cases standing at 93,794 cases. We have today new recoveries standing at 1,572 cases. And that leaves us with a total number of accumulated recoveries at 60,615 cases. We have today, unfortunately, quite a high number of new fatalities today, standing at 32 cases. And that leaves us with an accumulated total of 518 fatalities. Most of the fatalities today continue to be patients with the usual risk factors, that is, with underlying medical conditions such as high blood pressure, diabetes, and high cholesterol. And our deepest condolences to the friends and families of the deceased. So now I'd like to talk about observations about the new confirmed cases today. Of the 4,887 new cases, we have actually half of these cases were detected from active case findings among inmates at the Bangkok Remand Prison and Central Women Correctional Institution. So these confirmed cases stand at 2,835 cases. So although this is quite a high number, they are by nature or by default already isolated from the general public. And the Corrections Department and other authorities are doing their best to manage the situation of the infected inmates. And these inmates have been immediately taken to healthcare facilities for treatment and isolation. And all prison personnel have been vaccinated as a preventive measure. And this afternoon, the correctional institution will be giving a press briefing to give the public more information about this particular incident. Moreover, other clusters of infections were found at Ban Pong Hospital in Ratchaburi province and among a group of gemstone dealers in Jantaburi province. And this case was already reported yesterday by Dr. Apisamai. And as for the nationwide situation today, the CCSA has reported that there are now 14 provinces with no new cases. But the new cases, new confirmed cases continue to be concentrated in Bangkok and its vicinity, such as Samut Prakan and Pathum Thani provinces, and they come from active case findings in the discovered clusters and factories. And the majority of these new patients continue to be those in close contact with family members who've been infected with COVID-19. Moving along, I'd like to give you some updates on our measures to speed up the vaccination rates in the country. And as I mentioned yesterday, the private sector has been actively working with the government to help with efforts to tackle the pandemic. And we will continue to have information on these updates in due course, so you will know where and how you can access these services. The government has been collaborating with Bangkok Metropolitan Administration, or the BMA, and the private sector through the Board of Trade of Thailand, or in Thai we call that the Sapa Hauการค้าแห่งประเทศไทย. So they've been collaborating and setting up 14 vaccination units outside hospitals to facilitate easier access to vaccines for residents in Bangkok. And most of these venues are department stores, private companies, and petrol stations. And each of them will work with a designated hospital who will provide medical staff to give vaccine jabs. In other provinces, the governors are working equally hard to get the population inoculated as soon as possible. And yesterday, the Prime Minister visited one of the first 14 units at Central Department Store in Lat Phrao district, and they teamed up with Ramathibodi Hospital. So you can see in the video we have on the screen right now. This particular unit can vaccinate up to 1,000 people per day. And the Board of Trade of Thailand is proposing to launch 11 more of these vaccination units in the near future. And once all 25 units are operational, they can serve up to 38,000 to 50,000 people per day. And it's planned that these vaccination units will be in service for at least 7 months. So, about the numbers of vaccinations we have administered to date. So as of 12th of May, yesterday, Thailand has administered over 2 million doses of vaccines already. And out of this, 1.39 million people, or over 2% of the population, have received their first dose, while about 645,500 people, or nearly 1% of the population, have received both doses. And at least 15 provinces have administered vaccines to at least 2% of their population. And these provinces include such as Bangkok, Samut Sakhon, Phuket, Ranong, Tak, Chonburi, and Rayong. Phuket particularly has done very well. It's already inoculated 22% of its population. And about side effects. So this is where there's been widespread media accounts of side effects. Let me report to you that during our experience of inoculations, we have about 89% or almost 90% of the people who were inoculated had no side effects whatsoever. However, those who did experience side effects had minor symptoms such as muscle pain and headaches and fatigue and nausea, and only 13 people suffered from severe side effects. So that's a very low ratio of a 0.67 per 100,000 people. So 13 cases out of 2 million, that's very low. And therefore, the CCSA would like to stress some information from the World Health Organization that explains here, you'll see on the slide on the screen right now, that the serious reactions following vaccinations are very rare. And that's also one point that Dr. Tawisin just stressed right now during his briefing. But even in the case of such rare incidents, you will be able to contact the facilities you receive the vaccination to get proper health care, and so that the symptoms can also be carefully investigated. So, before I close my briefing, I'd like to draw your attention to another WHO recommendation on how to protect your friends and families in case you do contract the COVID-19 virus. So what do? You have the slide. Okay, the slide is up. So if you do contract the virus, You'll be asked to self-isolate at home or in a healthcare facility, and you need to contact the public health authority, the local health authority, and they will be able to notify your contacts and inform them about their next steps. You also need to contact the people you had physical contact with or spent more than 15 minutes with at a closer distance than 1 meter. And you could think back 48 hours and disclose information about your movements, and that would be very helpful in preventing any further spread of the virus. Now I want to part today with some food for thought during this lunch hour. Very important message is that throughout our experience with COVID, throughout this whole entire year, people from all over the world have experienced the same frustrations. They've shared the loss of loved ones, and yet still, COVID continues to loom everywhere, not just in Thailand. Despite the positive note that viral transmissions have subsided in countries where there have been high rates of vaccinations, the World Health Organization has also warned about the danger of virus variants, which could be a risk factor for recurrence of new waves of infections, and that it is highly likely that the COVID will be a part of our lives for quite some time in the future. And therefore, public health tools besides vaccinations like distancing and mask wearing and personal hygiene that have always helped prevent transmissions, as basic and as humble as they may seem, these tools will still continue to be powerful tools that can prevent everyone from contracting this disease. And it should be a standing practice to be observed at all times, even after you've been vaccinated. And Dr. Tawisin has also stressed this particular point. And I want to also reiterate that an equally powerful tool to tackle this pandemic is the collective efforts of society to work and cooperate with the government to resolve any issues and any shortcomings together by synergizing efforts and contributions constructively. We're glad that in Thailand's case, we have the strong support of our private sector as well as His Majesty the King in supplying additional facilities for vaccinations and treatments of patients. We also have the support of the media to help disseminate correct information to counter fake news. Any government in any country cannot overcome this pandemic with such collective efforts of society and the cooperation of the people. By reducing your own risk of transmissions and complying with public health measures, you are doing your part and your contribution to rid the world of this pandemic. Because, to quote an expert from the World Health Organization, COVID isn't going anywhere unless it's gone everywhere. So I thank you for doing your part so far, and let's stay and continue to be positive in our fight against COVID together. So that's all I have for you today. Thank you very much for your attention. ขอบคุณค่ะ สวัสดีค่ะ